Well, we know COVID-19 can cause serious illness, and some sufferers are still reporting symptoms weeks and months after they first tested positive for the disease. Symptoms can include brain fog, dizziness, depression, short of breath, fatigue, hair loss, a distorted sense of smell, headaches, and that's not a complete list. In Canada, an estimated 20 to 50% of those who contract the virus will experience long-term symptoms, according to the CBC. My next guest is a researcher with a unique perspective on long COVID. Her interest in the condition is more than just academic. She suffers from long COVID herself. Now she's using her expertise to learn more. She hopes to follow 120 long haulers and answer these questions: whether the severity of long-haul COVID is related to rheumatological complications triggered by the illness, why some patients develop autoimmune-like conditions and who's at most risk of developing them, whether vaccination plays a role in the severity of long-haul symptoms, and whether most people see a change in their symptoms over time. Manali Mukherjee is an assistant professor of medicine at McMaster University. She's a lead researcher into a study on long COVID, and she joins me now from Toronto. Thank you so much for being here with us. So, I mean, you've been affected by long COVID for more than a year now. What sort of effects have you been experiencing?
I've been going through some fatigue, headaches that keeps on coming in and going out, and mostly fatigue. That's just been the worst of everything. There were some blood pressure issues, and what's really worrying is you never know when you're going to get hit again. So some weeks are good, some weeks are bad, and all you have to do is just listen to your body and wait it out.
Yeah, I mean, you used the word worried. I mean, even though you're a scientist, I mean, when these things hit you, you know, maybe part of your brain is able to see it from a sort of a dispassionate scientific remove, but you're also experiencing it viscerally, emotionally. How has that been, trying to balance those two?
You know, it's a conflict. Being trained in immunology, you do know that viruses are notorious for leaving a little bit of a remnant of these inflammatory issues, and there can be dysregulation in your immune system, which can have these after effects and general feeling of unwell. But when that stays for longer and when that keeps on knocking you around, because you do take your health for granted, especially when you're young, um, it leads to anxiety. And there would be one part of me telling me, you know what this is, just rest it out, it'll be fine. But then there is this other side which gets worried, because after all, it's your health, right?
Yeah, absolutely. So you've put together a team to study long COVID, and you're studying a group of patients who have it. So what's the biggest question you're hoping to solve here?
What we are particularly interested at McMaster, the team that we have together with Dr. Costas Stelios and Dr. Sarah Swenningson in the lead with me, we are trying to understand if there's a subset of long COVID patients who may have immune dysregulation in the form of rogue antibodies that gets generated within our body as a response to the virus when you were initially infected, and whether that would be something that attenuates with time, or if that actually ends up with clinical symptoms and becomes a diagnosis for life. I don't believe every long COVID patient will become sick throughout their entire life. I do believe, and of course there's a big factor of hope that we will all get better, but there might be an unfortunate subset that ends up with a diagnosis for life and requires medical intervention.
Before we go, I wanted to ask you this. So many people will be affected with this. We do have long-haul COVID treatment centers, but there's often a year-long waiting list. And even then, many people have written to me saying that the doctors are telling them that right now there's not much they can do for them. I mean, it must be so frustrating, but you're confident there will one day be a treatment, or you know, many different treatments depending on the symptoms or underlying causes, I guess. But in the meantime, what is needed to deal with this backlog of so many people who need help?
Look, Kim, I don't believe there's going to be a one-size-fits-all kind of a therapeutic intervention. because if you look at the way long COVID is showing, it's showing as a constellation of symptoms. Some people come up with neurocognitive issues. Somebody is coming up with lung issues with shortness of breath. Some people are coming up with even gastrointestinal problems. So what essentially the long COVID clinics are doing is sending the people to the right specialist, and the specialist, they are dealing with it. So even the research that's going on, the different researchers, the communities, they're also having these specific questions that they're trying to answer. So I believe as a society, we are all part of this pandemic, and as a society, I think we are going to get out of it together. Do have faith.
We'll leave it on that hopeful note. Best of luck with your research and with your recovery. Manali Mukherjee, thank you so much.
Thank you so much, Kim.
And for more information on Manali Mukherjee's research on long COVID, you can head to our team's page on McMaster University's website, and you'll find a link to the study on long COVID.